Hi, my name is Luanne Chawla. I am a member of the Vermont Workers Center Put People First campaign, and I'm also a social worker who works with children and families. And I agree with what most everyone has said, and I think that we are in a pivotal point in Vermont that we can make a major change here, not only for Vermonters, but for the rest of the country, because I think the rest of the country is going to be looking towards us, to us. And I think if we want to speak about social and economic justice, we can't do that unless we really have universal health care. I think it's pivotal to all Americans and all Vermonters. The cost of health care is bankrupting middle class and working class folks. And it concerns me when I hear these sort of false arguments, and I want to make sure that people are aware that they are false arguments, such as we can't afford it. I think the real question here is how can we not afford it? Right now, you know, it's the middle class and it's the working class that have to pay the burden of health care, and it's destroying us as a country and as a community. And the other false argument that we hear is that access gets restricted if we change to the system. And the reality, like you've heard from many people already, is that our access is already restricted. There are people who are making decisions of whether to eat or whether to go see a doctor, or as that woman said, you know, needing to pay tuition for her child or dental care. So we already have a system that's broken and where access is restricted. One thing I just want to point out, I think because we are in a pivotal place in Vermont, that we may be looking at a number of folks coming in from the other states that have corporate interest, and it concerns me that these kind of false arguments are, we can be inundated by them, and I think we really need to understand that you know, that they are false arguments, and frankly, 99% of Vermonters and 99% of this country will benefit from universal health care. Thank you.
Thanks. Is there a second person in Middlebury? Okay, so then we will come to Montpelier.
I think I'm first. Lila Richardson from the Office of Healthcare Ombudsman. I did submit written comments because otherwise the alternative was to talk really, 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 really fast for 2 minutes and be incomprehensible. I wanted to emphasize just 2 points that maybe other people won't spend some time on. One is the concept of trying to have some kind of an exceptions process for benefits. The Healthcare Ombudsman has had a lot of experience working with people who require treatment and equipment that's not covered either by Medicaid or by other commercial insurance packages, and there is a regulation that allows people to ask for non-covered services if they can demonstrate medical necessity. An example of the kind of thing that's covered for some people is an air conditioner for someone with respiratory problems, and coverage of this kind of non-traditional service, which is, you know, not a medical, not usually a medical piece of equipment, can help to prevent very costly covered services like hospitalizations. So we would recommend thinking about including some kind of exceptions process, or at least looking very carefully at those kinds of services that are not traditionally considered medical. The other area I just wanted to emphasize was cost sharing. The HCO is really concerned about having a viable cost sharing structure for Green Mountain Care. In our experience, cost sharing in the form of deductibles, coinsurance, and co-payments really affects utilization of benefits. I know the administration has recognized that in its presentations at the listening sessions, and as has been indicated in those materials, people avoid both necessary and arguably unnecessary care because of cost sharing. They don't differentiate.
Time.
So that's, read all about it in my comments.
Hello, my name is Donna French, and I am here today as a member of the Healthcare is a Human Rights campaign. I am sharing my story because the benefits discussion must start with the health needs of the people and their ability to get the comprehensive, appropriate care required by Act 48. We need a health system focused on care, not coverage. A couple of years ago, I woke up at 2:30 a.m. with a pain in my chest and ended up in the emergency room. I was there until 4 p.m. that day and had all kinds of tests to diagnose my condition. I had no insurance at that time, and that visit cost me over $12,000. Not only was it stressful to be suffering and not know why, but it was also stressful thinking, how will we pay this bill? This is why we need universal health care, where a person's ability to pay will not keep them from receiving adequate care and will not face bankruptcy. I want you to know that my health care should not be at the cost of anyone else's needs. 48 means health care for everyone.
Thank you. And before we switch to the next site, I just wanted to ask people to please try to wrap up when you hear time the first time, because we are trying to accommodate a large number of people and want to try and hear from as many folks as possible. On that same note, please remember that if your comment has already been stated and you can refer to someone else's so that we can get to as many folks as possible, that would be greatly appreciated. So now we will go, I don't believe there's anyone in Newport to testify at this time, so we will go to Rutland.
Thank you for this opportunity to testify today. My name is Kathryn Thomas. I'm a member of the Healthcare as a Human Right campaign of the Vermont Workers Center. I'm now retired, but was a practicing clinical social worker for 30 years. Regarding what services should be included in Green Mountain Care, I believe mental health services are an essential part of primary care. These services should be encouraged because they not only increase emotional health, but they also foster physical health. Anxiety, depression, drug abuse, impulsivity, low self-esteem often are the seeds of bad self-care and all too predictably lead to chronic illnesses. Helping clients navigate a life transition, heal after trauma, have better coping skills, and/or improved relationships with others has a ripple effect in a positive direction for their own health and that of those close to them. For instance, being proactive about treating a new mother with a postpartum depression also significantly affects the development of her infant and the family system. In addition, when a significant physical health problem is diagnosed, for instance, cancer or heart attack, many people need mental health treatment to cope with their diagnosis, follow through on treatment, and make recommended lifestyle changes. Collaboration and communication between primary care physicians and psychotherapists are absolutely necessary, and the new system should make these a priority rather than an afterthought. A number of other people testifying have mentioned some of the barriers which currently exist in our mental health care system, such as co-pays and having to constantly get reauthorization for treatment. I would just encourage you to work with the mental health community, social workers, mental health counselors, psychologists, and psychiatrists as you design the new system. It can be so much better than the one that we have now. Universal coverage for comprehensive mental health care. Thank you.
Thank you. Can we hear from the second person in Rutland, please?
Yes, and thank you for taking these testimonies. My name is Marion Farrell. I live in Rutland, and I'm a member of Put People First, an initiative of the Vermont Workers Center. And I am concerned for the Vermont citizen who, like myself, may not have adequate health care coverage as it does not address the dental care. Many people have spoken about this today, so I won't go on with it. But I do believe that the good health care is a human right. I am without dental care insurance since I've left full-time employment some years ago, and it is of deep importance that not just my needs, but all of Vermonters' needs for health care be treated equitably. A comprehensive universal health care plan is what will keep Vermont healthy and our state in a healthy system to keep all Vermont people healthy. Thank you very much.
Thank you. I don't believe we currently have anyone signed up in Springfield, St. Albans, or White River, so we will go to Williston.
My name is Peggy Carey. I'm a family physician presently working in Cambridge, Vermont. I'm also chair of the Vermont Physicians for National Health Program. I have 3 brief points to make. The first point regarding benefits is that we've heard vision and dental over and over, but I think it's essential that we include hearing care in our benefit package. This hearing affects kids, babies, their language skills. It affects middle-aged people. They can become withdrawn, depressed, and recently I had to deny a commercial driver's license to someone because he couldn't afford hearing aids. Second point, insurance companies use co-payments to prevent people from seeking care that may not be necessary. However, co-pays discourage people from seeking necessary care, and high deductible plans are even more effective at preventing people from seeking care. How many times as a family physician have I seen people delay care for a wound, for a breathing problem, or headaches, only to have serious health outcomes? I went to medical school to learn just to discriminate between common versus serious presentations. Is it bad medicine to reassure a patient that they don't have pneumonia or an infection? I urge you not to impose copays or deductibles. Finally, health care needs to focus more on public health. When one looks at factors influencing health.
Thank you.
Thank you.
Hi, my name is Tina Marie Bradley. I'm a resident of the Old North End in Burlington and a member of Vermont Parents United. In 2010, while walking to work, I stepped off the sidewalk and broke my right foot. In September, while healing, I fell at work and sprained my left ankle. While healing from the sprain, I refractured my right foot. This led to an ankle fusion in March the next year. Much physical therapy and recuperation time happened surrounding these events, which now affected my mental health to the point that I suffered a severe manic episode and was admitted to Fletcher Allen Healthcare. For the first time in my life, I was hospitalized for psychiatric symptoms. I remained at SHEP 6 for a period of 3 weeks. During this time, my ex-husband gained custody of our son, even though he had no residence of his own. My son spent over a year staying with with my stepson Frank and his family, while I rehabilitated myself mentally, physically, spiritually, and emotionally. Today, my son is back in my care, and I am as stable as is possible. My son and I are happy in the Old North End, and he is a healthy, happy, pretty well-adjusted 14-year-old looking forward to high school at BHS. My story is just one of many, showing the importance of comprehensive health care, for without this, my recovery, more than likely, would not have been possible. This is why I feel strongly about mental health being included in universal health care, but not to the exclusion of other health care needs. Thank you.
Thank you. We'll go to Brattleboro now.
Hello, my name is Lynette Lewis. I am from Putney, and I have lived in Vermont for 41 years, and I'm quite disabled. I've survived 37 surgeries. I'm honored to be a member of the Vermont Workers Center for Put People First campaign, Healthcare as a Human Right. I could tell you many stories, but today I will tell you one about the healthcare system in Brattleboro, which is indicative of the healthcare as it exists in this country, a country that is supposed to be the best and the brightest. As you hear my testimony, I ask you to remember that this situation could happen to any of us. This is a testimony that represents all, not just me. I thank the Green Mountain Care Board and legislators for asking us to share and for working so hard to hear all Vermonters' needs. Several days ago, I began to experience a very serious asthma attack that could not be controlled by normal inhalants. The respiratory problem became quite grave and required continual treatment at the hospital. It was arranged for me to have my insurance company pay for a nebulizing machine and its medication. It's Medicare and Medicaid and SilverScript. My lungs are quite unhealthy. To make this short, Medicare and Medicare Medicaid, Medicare, and SilverScript refused to pay for a nebulizer machine at the cost of $200. After 20 to 30 calls, I found no other pharmacy that had one nebulizer machine in Windham County and found only one in Cheshire County, New Hampshire. I would have to drive and pick up the machine, and as a person with disabilities, it is very hard to travel. And the cost of the medicine to go in the machine is very expensive as well, or I could order it from Texas and wait for it. For the first time after surviving 37 operations, I realized that if I did not get the medication, I would die. I couldn't breathe. There was no air at all. That's an awful experience. We can't prioritize benefits. They are all important. A person should not have to travel to a different state to obtain medication and a machine that may save her life. We are all people on this earth. We all must enjoy our human rights because they are not privileges. We need health care, not benefits. Thank you.
Thank you. Oh, I'm not. Have a second person in Brattleboro?
I'm Carol Perry, and I'm a member of the Vermont Workers Center. I got involved with the Workers Center when the flood from Irene devastated the mobile home park, Glen Park, and devastated all the people that live there. And I saw how the Workers Center works, how well they work, and how they work with our government. And they actually get things done. I know health care is a human right that we are not all getting. It is not affordable for everyone, especially those of us that are on a fixed income as Medicare, which Medicare just barely takes care of our daily expenses. There's nothing left for medical. I am always owing either a doctor or a hospital. First of all, I'd like to know who decided that the insurance companies were capable of making decisions and overriding a doctor's diagnosis, and has the right to tell the doctor that they'll not cover the payment if they don't agree the procedure is necessary. My daughter has been having a medical problem, and she's been seeing her general practitioner. And in her case, the general practitioner has the right, has to give you,
Time.
Thank you.
Thank you. We'll go now to Middlebury. Do we have anyone in Middlebury?
Yep, I'm here.
Okay, thanks.
Hi, my name's Katharina McCarty, and I'm here with the Vermont Workers Center, and with Healthcare is a human right campaign. And luckily, I have Vermont state health insurance now, but there have been periods of my life as a young working adult when I didn't have health insurance, and that was sort of a frightening way to live. You know, during that time, there was always sort of this looming fear of what would happen to myself and to my family if I were to get sick or hurt. And that's not a way to live. Luckily, I'm a very healthy person at this point in my life, but I know that there's members of our communities that are sick and are hurt and that can't get the care that they need, and I think that's something that affects us all. So what we want is a system that includes everyone's needs, and a system where no one is excluded and no one is forced to sort of live in fear of not knowing what will happen to them. And that system would include dental, vision, and mental health care needs. Thank you.
Thank you. I don't believe there's a second person in Middlebury, so we'll turn to Montpelier.
I'm Marjorie Power, and I'm a member of every healthcare reform organization that ever was or will be, because I lived for 20 years in England, and I experienced a socialist healthcare system. I had 2 children there, and it was wonderful. And so when I came back here, I thought, they have to be joking. Only they weren't. And so here we are, we're finally getting serious. And I really want to talk not so much about the individual items in the benefit package, but how we should look at it. I started out listing things, but I don't think that's the right way to look at it. We're sort of, for the United States, pioneering here. And we have a history of looking at health care the wrong way. What we're doing here is setting up a system that will take care of every person in the state of Vermont for their health welfare. What is good for all Vermonters? So we're not concerned with a tiny little fraction, this employer's workforce. We're concerned about everyone. And so when we're talking about cost, I mean, we've heard testimony tonight that we have to figure out the cost before we figure out the benefits. That's way wrong. Because what we need to do is decide what we need, what is good for Vermonters. Then we can figure out a fair way to pay for it. So we are going about this the right way. And one of the things, though, when we consider the cost, as we eventually will, is that what we have not traditionally considered or included among the cost is the externalities.
We have to move on, Marge, but we'll catch up with you another time.
Go to Walmart and see the teeth.
Thank you.
My name is Walter Carpenter. I live in Montpelier, Vermont, and I'm a volunteer on the Vermont Workers Center Healthcare's Human Rights Campaign, and like Marjorie, and probably about every other one too, I joined this after a particularly debilitating experience with the American health insurance practice of systematically working to deny benefits and care in order to enhance profit. I came excessively close to dying from this experience. An example of this is when I needed an MRI. I had liver disease from natural causes, and we did not know what these causes were. Several previous radiology tests had failed to discover them. I had private insurance through an ex-employer at the time. Supposedly this plan was a comprehensive medical plan, but when it came time for the MRI, the insurance company, United Healthcare, said that an MRI was somehow excluded from this comprehensive coverage and not medically necessary. By this time, I was a deep shade of yellow from the jaundice caused by the liver disease. It was getting worse by the day. An MRI is an expensive undertaking. With my situation critical, I was forced to decide to either proceed with the MRI and risk thousands of dollars and years in medical debt, or cancel the test and, most likely, die. This is just one small sampling of what I went through. It is just one small sampling of what thousands of other Vermonters have also had to go through. It was not the first or the last time that I had to make this choice. For better or worse, and some probably will say worse, the MRI that my doctor and I, with the aid of a lawyer, finally got before it was almost too late, as part of this comprehensive medical coverage, found what was wrong and saved my life. Because of this experience, I have advocated for and will continue to do so a system of universal health care in Vermont where health, dental, mental, vision is included. Where no benefits, no care, denied.
I don't believe we currently have anyone signed up to testify in Newport, so we will go to Rutland.
Good evening. My name is Courtney Madison. I'm the founder of Vermont Students for Growth, Opportunity, and Prosperity, and I'm here tonight to address some unique concerns of young professionals and students in the state of Vermont. 50% of my peers are either under or unemployed. And that's a national statistic. And we feel that by not addressing the effects on Vermont businesses and Vermont organizations with the Vermont Care Boards Act 48, and without a priority for fiscal transparency, there's a certain amount of hesitation towards hiring in our state. So we do ask that you look and discuss further how you plan to fund the program before the program is laid out. Also, we, as healthy Vermonters, for the most part, younger Vermonters tend to be healthier, and I think you're pushing a lot of us out of the state. And I think you'll soon see, as you often see Canadians come to America for health care, due to their universal healthcare system that we attempt to model, you will see Vermonters leave the state of Vermont, go next door to New York, New Hampshire, or not really Massachusetts, but they will look to other states for their healthcare needs. So I think when you look at it, you really need to think about personal savings accounts for healthcare, because I think we heard tonight that everyone has an individual need when it comes to healthcare. Some people need vision, some people need dental. I don't think that you can cover everyone with a universal plan. I think there needs to be individual options, and I think one of those options is a competitive personal savings account for people to save for future healthcare costs. Thank you.
Thank you. Do we have a second person in Rutland?
Yes, hi. My name is Samantha Brawley. I'm a member of the Vermont Workers Center Healthcare as a Human Right campaign. I was born and raised in Brattleboro, and I'm a senior social work and sociology major at Castleton State College. I am here today to share my story because people's health needs and their ability to get comprehensive, appropriate care is very important. Recently, I went to my eye doctor with interest in changing my prescription because my eyes had become extremely worse. My eye doctor informed me that both eye exams, one for lenses and one for contacts, are separate bills and each have a fee well over $100 that is to be paid upfront. My health insurance, like most others, does not cover vision, which means that I have to come up with the money just for the exams. I was also informed that new lenses are almost $200 and contacts are about $40 a box each month, which are also separate bills. Unfortunately, I do not have the money to pay for this, and my eyes are being left untreated. Each day I suffer with poor vision and migraines, especially when I'm driving or working as a waitress. This is my story, but I do not want you to choose my needs over anyone else's. That is why I'm calling for a healthcare system that puts people first by meeting everyone's health needs. Thank you.
Thank you. We'll go now to White River.
Yes, my name is Ann Reynolds. I'm a healthcare provider. I'm a psychologist. I want to second Marjorie Power's, I think she was from Montpelier, statement that I think the board is going about this exactly right. Benefits, we have to decide what we want before we know what it's going to cost. That other argument just doesn't carry water. And Marge also co-opted what I wanted to say, because I too lived in England, and that's when I became a single-payer advocate. The national health system in England, service in England, has survived governments from the right and governments from the left, and it's never questioned that that is going to be a political football. So I think that probably once we get over the hurdles and actually have single payer, we'll see not only other states joining us, but the other party joining us as well. Thank you.
Thank you.
Hi. My name is Kyra Lewis. I'm part of the Healthcare as a Human Right campaign. And I wanted to talk a little bit about what I've been going through with my current healthcare issue. I became really sick this past October unexpectedly. I came back from a trip and had vomiting, diarrhea, stomach pain, and fatigue, and continued to have that 8 months later after having, tests for parasites and all those other things that you would expect that might be caused by. And after a couple weeks of this, I tried to find a primary care doctor. I had just graduated from college, so didn't have one back home. And after searching throughout Windham County for female providers that would accept my insurance, the one with the lowest waiting period was just under a month. So instead, I sought naturopathic care. because the first person that I found was able to see me within the same week. And so, months later, I was able to get into an office with a gastroenterologist. And as my system continued to have this issue, and the only test that I could afford to find out what was going on was actually not the exact test I needed. We were able to decide together that an upper GI series made more sense because I couldn't afford a lower GI series. And so, after I still have a bill of over $350 that I can't really afford, but I also don't know what's wrong with me because I couldn't get the procedure I needed because I just don't have the money after my insurance. So I'm here to say that my story shows several things. We need to make sure that people have access to the doctors that they need, and not only do they not have to wait weeks or maybe a month to see someone when they're sick, vomiting, and having diarrhea from seemingly nothing, but that people need to not pick and choose which procedures they have based on how much money they have available. And so I'm saying essentially that we need to make sure we have comprehensive care. I would have never expected as like a healthy 23-year-old that I would be eating just broth for breakfast and lunch and dinner. That's all. Thanks.
Thank you. We'll go now to Williston.
Hi, I'm Kim Fountain from the RU12 Community Center, and I ask that you include the full range of coverage for transgender-related health care, including but not limited to access to hormones, all labs, and sex reassignment surgeries, and to remove all barriers to safe and effective surgeries, services such as EMR systems that do not have transgender-specific options. Transgender people on Medicaid and Medicare do not have access to necessary transition-related health care, and nearly all insurance plans categorically exclude coverage for transgender-related medical treatment, even when that treatment is covered for non-trans people. For example, thousands of women experiencing menopause are prescribed hormones, but transgender women who are often denied this similar prescription for hormones. The current policies that exclude comprehensive coverage for trans individuals are not neutral policies, they are discriminatory. For instance, Blue Cross has argued that exclusions do not discriminate on the basis of trans status. They say sex reassignment surgery is simply not a benefit that the employer provides to anyone. This is like saying pregnancy coverage is simply not a benefit provided to anyone. The main argument given to justify the exclusions tend to be cost. The best available public data on insurance coverage is from San Francisco. After about 3 years of providing coverage, they had gathered $4.3 million and paid out just $156,000. Then they lowered their PEPM cost and then paid out even less money. And in 2007, they finally declared the cost de minimis and stopped pricing care separately. Those who have access to Medicaid medical coverage often find that additional barriers to services, such as procedural codes that are tied to binary constructions of gender, which are exclusionary and added greater and unnecessary complexities to the system. For instance, if a transgender man requires a hysterectomy, the option is not covered because those codes do not list hysterectomies for men. We should locate our arguments for coverage within commitments to equality and fairness, equal benefits for equal premiums. Doing so helps us to see that this is not so much about adding benefits so much as removing an exclusion, much of which could be addressed through changes in regulations. Thank you.
My name is Earl Wright, and I am a member of the Workers' Center. Franklin D. Roosevelt, in 1944, in his State of the Union message, proposed an economic Bill of Rights that would take effect after World War II was done. One of these rights he listed was the right to adequate medical care and the opportunity to achieve and enjoy good health. We're finally beginning to catch up with FDR. I just want to echo what a lot of other people have said today about, rather than thinking about how much this is going to cost, we should first think of what we need to do. And if health care is a right, then it cannot be abrogated. We don't want to say whether we're going to have this right or not. If it's a right, we find out a way to do it, just as with freedom of speech or freedom of the press. We don't try to have that freedom for one person at the expense of somebody else. So I would advocate that we look at what we need first, because it is a right, and figure out how we're going to do it. Thank you.
Thank you. We will go now to Brattleboro.
Am I on?
Yes.
Hi, I'm Rebecca Jones. I'm a physician here in Brattleboro, and I hope I don't get too emotional here. It's really exciting to be here, and I really appreciate you guys doing this for us. I'm the Vermont State Director for Doctors for America, and I know that this endeavor is a very difficult one for Vermont to face, because I know we're facing theoretically an $8 billion price tag by the time we go live with this. So what I've been working on, and what I'm really excited to share with you, is this project that I'm working on with 350 Vermont and the Vermont Workers Center, and a lot of my colleagues throughout the nation, on what I'm calling the Vermont Green Print for Health. And the idea is to try to figure out ways to keep people healthy in the state. And what we're focusing on right now is the concept of a public transportation system designed around walking and biking for the entire state. And what I'm really excited about is, just today I read a report from Dr. Loviso Mori from Robert Wood Johnson Foundation, who is talking about just this. So it's in the public eye, and I would like to petition the federal government for a grant to do this. So I'm hoping to get a chance to talk to you guys directly at some point. And thank you. That's it.
Thank you. I don't believe we have a second person to testify right now in Brattleboro, so we'll go here to Montpelier.
Wait,
I guess I'm sorry. You weren't on my sheet. Go ahead.
I came in early. I participated in the very first survey of dentists in 1999 here in Brattleboro, and at that time Vermont had a critical need. Now we are in crisis for dental care, and little has been done in the 13 years to implement the changes necessary to correct dental health care for all Vermonters, regardless of socioeconomic factors. It is time to implement the necessary policies and stop using meaningless rhetoric. Here's my story. My 3 sons had to travel over 40 miles round trip to Greenfield, Massachusetts, to a pediatrics dentist named Dr. James Roman. And I'm very grateful to all of you for the Dr. Dinosaur program for keeping them healthy. But my own dentist decided that he would no longer take the state insurance as reimbursement because the paperwork was too long and it took too long to get reimbursed. So how have we changed that in 13 years? And when I had to get dental extractions, I had to drive all the way to Bennington County to the Oral and Facial Surgery Associates in Bennington. And that took 4 hours round trip, plus the time that it took to take my teeth out. For those without transportation, dental visits are impossible. And emergency rooms in our area are frequently overwhelmed with patients who are no longer able to get to a dentist and have nowhere else to go for the pain. I am a town rep, and I participated this year. I'm so proud of the United Way's Free Dental Day in 2012. That 120 patients had extractions, fillings, and were seen by local dentists in one day. I had a tooth extracted by the Massachusetts dentist, Dr. Peter Albanese, who owns several practices. Why is it, though, that in 13 years after identifying crucial shortages in dentistry, that we've not been able to target those wonderful dental schools and make attractive packages to new graduates so that our state has adequate available dentists?
Time.
Thank you.
Thank you. We'll turn to Montpelier.
Hi, my name is Bernie Noe. I'm a naturopathic physician and I practice here in Montpelier. And I wanted to encourage the board tonight to include access to out-of-network laboratory coverage in the benefit design. The reason being that as a naturopathic physician, I order all the standard tests that any conventional physician would, but in addition to that, I use other types of testing, blood food allergy testing probably being the best example. And by and large, that type of testing is done by laboratories smaller laboratories that are not in-network. There is some testing available through in-network labs, but it tends to be very limited and actually far more expensive, usually 10 times or more the cost of some of these specialty labs. And through identifying the underlying causes of an individual's problems, such as food allergies, we can frequently avoid an awful lot of other health care, in addition to helping those individuals to dramatically improve their health. And currently, Medicaid does not include coverage of out-of-network labs, whereas the private payers do. There may be an additional out-of-network deductible, but because those private payers also allow physicians to pass through bill, it allows me to bill the provider myself for those charges, hence making it an in-network charge so the patient gets full coverage for it. The end result has been helping thousands of people with a variety of health care complaints, some of who were very ill and who expended many thousands of dollars in medical care trying to identify and treat what ended up not being the root cause of their problem. So this is something that I think should be viewed as not only a benefit in the sense that something that might increase cost of the system, but would actually help to dramatically reduce cost of the system. Thank you.
Well, my name is Travon Lucia, and I always listen carefully to my personal physician, Bernie Noe. I suggest that you do also. I'm Secretary-Treasurer and advocating for the Vermont State Labor Council, AFL-CIO, with our 9,800 members, so I'm going to share our position. Most of our members still have fairly good health care coverage, and that's because we've given up wages and other benefits as well as working conditions to keep our coverage. This is also true for unionized teachers and state employees, but especially for the last 15 years, we've been forced to take concessions or even to have to go on strike to try to maintain health care standards, and it's been a losing game for us, quite frankly. This system is not working, and it's going downhill fast. That's why we support comprehensive, universal quality health care reform, one that guarantees health care at levels that meet our needs. We would not support a reform that would lead to our getting less quality care. We oppose a two-tier system that would only provide basic care for most of us while allowing for Cadillac care for the wealthy. The discussion of benefits should proceed from a commitment to meeting people's health needs, our ability to get comprehensive, medically necessary health services as stated in Act 48. Medically necessary care obviously includes dental, vision, and long-term care. The reality is that out-of-pocket fees would make many people go without or delay care, which would make us sicker and actually increases health care costs. This clearly harms those who have less money and who often have the greatest health care needs. Lastly, the issue of what health care costs and how it's paid for should start with our first committing to meeting people's health care needs, and then proceed to finance the costs by fair, broad-based taxes determined by people's ability to pay. Our view is that we should be treating health care as a public good, that we need to decommodify health care so that it's treated as a social right. I thank you.
Thank you. We don't currently have anyone signed up to testify in Newport, so we'll go to the first person in Rutland.
Thank you. Hello, my name is Timothy Abraham, and I am a member of the Healthcare as a Human Right campaign. Thank you for your opportunity to testify and for your good work. I'm one of the lucky ones. I have VA health care, and I'm well taken care of, but I have seen the suffering that comes with the lack of health care services. I'm asking for it all for all of our people. Please include mental health, dental, vision, long-term care benefits in the plan. We have been told that we can't afford this, and let's not be fooled. We as a country have the money. The challenge is to get the money that we sent to Washington back from Washington to support the needs of Vermonters. In 2010, the United States spent $1.25 trillion on what is called national defense. That's 41% of the military spending in the entire world. We have the money. Our health care service is twice as expensive as many other rich European countries. According to the World Health Organization, in 2008, the United States spent $7,146 per capita on health care. That's double what many other countries spend. We are already spending the money we need to provide universal health care. We have the money. So again, we can afford it all. I am asking for it all: mental health, dental, vision, and long-term care benefits. It's my hope that as you define coverage, you will understand that as a nation, we have money for comprehensive health care for all Vermonters. My hope is that you and our state and federal representatives will find a way to break the grip that corporations have on our care, and that you get the funding needed from Washington to create a system that serves all Vermonters. Vermont can lead the way, and you're doing it.
Hello, my name is Kristen Andrade, and I live in Rutland City, and I don't have health care coverage right now, and I am a registered voter. I've waited since 3:30 to speak my mind, which is still half as long as the last time I spent in the emergency room waiting for treatment. We need health care. We need it focused on health care, not on profits, and not coupled with employment. I worked at Easter Seals and was the director of a residential treatment center and a private independent school for adolescent girls with emotional and behavioral disturbances, and I worked there for almost 7 years. We closed in mid-February, and all of the 12 workers there, including myself, needed to be concerned with not only finding new employment, but also, more importantly, with finding employment that would give us health care benefits. Many of the staff had worked there as long as I had, and several for the last decade. I'm a classic example of why health care cannot be dependent on where one is employed. I simply could not afford to cover my health care when my job ended, but I was able to cover my dental coverage. If I become ill or get hurt or have an accident, my only alternative will be to visit the emergency department, where they will have to provide at least basic treatment for me. It could take many, many years for me to pay off any bills that I would incur, if at all. On a mental health parity issue, we need to de-designate the community mental health centers. They have a stranglehold on our communities. They're not providing good services in some areas of our state, and we need to go to performance-based contracts, like Doug Racine had advocated a while ago. As isolated individuals, we will always be powerless, but as communities in solidarity, we can achieve anything. I absolutely do not agree with Senator Randy Brock that bringing in more insurance companies to create more statewide competition is the answer. I think it's ridiculous. This looming paradigm shift in healthcare will be difficult not only for Vermont, but for the entire country. But it is not the hardest thing that we as Vermonters have ever had to face or to rectify. We need dialogue and we need leadership. We created this current broken system. Thank you. We need comprehensive care.
Thank you. I don't currently have anyone signed up in Springfield, St. Albans, or White River, so we'll go to Williston.
Hi, I'm Sue Deppie. I practice psychiatry in Colchester, and I'm speaking for myself and the Vermont Psychiatric Association Private Practice Committee. We must, of course, include full parity for mental health and substance abuse treatment. Our fields have been brutally micromanaged for over 20 years, as you know, far more than other specialties. Many clinicians have left practice, and Vermonters are therefore horribly underserved. True parity also requires the elimination of the barriers to access, such as managed care. We must cover a full range of psychosocial and biological treatments in residential, inpatient, intensive outpatient, and outpatient settings, including individual, family, and group therapies. Collaborative work should be reimbursed, including non-face-to-face time for consultations and communicating with other clinicians. We would include telemedicine. We would include phone calls with patients and families, which are common and necessary and often life-saving. And as should be case management services by any clinician, particularly in private practice where that's important. We need more access to specialized programs out of state. For example, eating disorders and dissociative disorders if they're not here. I've experienced them being life-saving for my own patients and enabled a patient to begin then doing outpatient work in a very successful manner. Finally, drug and other prior authorizations, as you are well aware, are appalling waste of time. We'd be happy to discuss mechanisms for reducing that hassle in much more detail. And our disorders that we treat are chronic and relapsing, so any authorization that is necessary after you negotiate the drug prices should be lifelong. I would beg to differ with Mr. Wenberg. You are doing lots of listening, and many, many Vermonters appreciate that, so we thank you. In my view, single payer can't come soon enough. Thanks very much.
Hi, I'm Dr. Chuck Bookwalter. I'm a pediatric dentist and the president of the Vermont Society of Pediatric Dentistry. I'm here to impress upon you the importance of maintaining the current requirement for health insurers to reimburse for expenses associated with hospitalization and general anesthesia when dental procedures are performed in that environment. While the vast majority of children are pleasantly managed in the dental office setting, we have a small subset of children who require extensive treatment, and general anesthesia is their only option. Last year, I treated 100 patients in the dental office or in the hospital setting. Most of these children were 18 months to 4 years old who lack communication and coping skills necessary for treatment in the office setting. Some of these children had severe medical conditions that limit their treatment their options for treatment. Maybe 20% of my patients were older children or adults with special needs. Picture a 2-year-old with 4 abscessed teeth, or a 4-year-old with 15 decayed teeth, or an 8-year-old with autism who's combative just for an exam, or a 40-year-old with a seizure disorder. Without treatment, they are all at risk for infection and pain, leading to more serious complications. The hospital, and specifically general anesthesia, provides our only safe modality to render quality treatment. Insurance reimbursement creates access for this group, so I implore you to follow the current state requirement to reimburse for dental treatment rendered in the hospital setting under general anesthesia. Thank you.
Thank you. It looks like we have someone in Brattleboro.
Yes, my name is Jim Grout. I'm from Westminster, and my comments come from 3 perspectives this evening. The first one, I'm the director of a small nonprofit here in town. We have 10 employees, and we are absolutely dedicated and have been for years to providing good health care for them and their families. It just gets harder and harder. You know, we can't join a pool. We do the best we can and provide exactly, I think, the coverage that most people want, but it is overwhelmingly costly, and I'd like to see us come up with a solution to that. The other one is from a community perspective. I serve on the board of directors of the Brattleboro Walk-In Clinic. We see over 1,200 people a year for free health care, and the health care is provided by doctors and dentists who do this free of charge. So started by Dr. Tom Evans some years ago. We're 19 years of providing that. And it's a wonderful thing, but it really shouldn't be necessary. We get a lot of people who would otherwise end up in the emergency room, and we provide that service at no cost through the generosity of those that provide the time. And then lastly, from a personal perspective, a few years ago, I lost my son in an accident, and he was in the hospital for about 4 days. And it was an awful experience, obviously, but we were very fortunate at the time that we had insurance, and the bills were over $80,000. So in addition to their personal loss, there was that coverage, but we had it. I then joined hospice as a parent for parent support, and there were about 10 of us in a support group, and 6 of those people who lost children had no coverage. So in addition to the tragedy of losing a child, they also had insurmountable medical bills. And I just think we can do better as a state and as a society. And so for all 3 of those reasons, I would ask you to work hard at your task, and we'll help you in any way that we can. Thanks very much.
Thank you. Do we have a second person in Brattleboro? No, doesn't look like it. Okay, so then we will go to Middlebury.
Are we ready? Hello, my name is Alice Colburn. Yes, I'm ready. Hello, my name is Alice Colburn. I'm retired, and I live in Middlebury. I am a volunteer for the Vermont Workers Center and the new health care. I'm here tonight to share my story because the benefit definition needs to be about our needs and comprehensive care. I have Medicaid, which is really good in most ways. I've had 3 sleep studies and was found that I have severe degree of obstructed sleep apnea. The doctor says my brain forgets to tell my body to breathe while I'm asleep. Medicare says this is not life-threatening. Key Medical has appealed, and my doctors, this claim 4 times so far. My doctor says it's a necessity. So far, Medicaid refused to pay. I came here to share my story about my needs, but I don't want my needs to be considered over anyone else. We must treat health care as a public good, like we do with the fire department, police department, etc. We couldn't do without these services. We shouldn't have to do without a health care. Thank you for your time.
Thank you. I think now we're back to Montpelier.
My name is Mark Ames, and I work in the addictions field for the last 25 or 30 years. And right now I work in recovery services, and I want to advocate strongly for making sure that addiction care is a part of what you do, because I think that it's going to be incumbent on you to do it because it's going to save the money that you're trying to manage in this process. My experience in working in addictions is that it's a chronic relapsing disease, and over time in treating it, a very smart man, Tom McClellan, who was the head of the Office of National Drug Control Policy, suggested that we treated with an acute care model a chronic disease. We send people to treatment for a short time, and we expect them to get better and live the rest of their lives without relapsing. And Con Hogan spent quite a lot of time working in the Department of Corrections, where 85% of the people there were there as a direct result of their substance use. And we need to do better with providing substance abuse treatment. Now, I've been working on the recovery end, and what we've been trying to do is create a system of care for people that's the ongoing care after you've had addiction treatment. And I'm here to advocate for supporting that part of the system as well, because the money spent, just as money doing prevention work ahead of in schools and with young people saves people from falling into addictions, if you can keep people from relapsing and needing to be treated again and again and again and filling the hospital emergency rooms because they've done boneheaded, that's maybe not the right phrase, but I communicate, I think. The problem is that people, I mean, the statistics are huge about what substance abuse does to hospital emergency room visits. And I think that we need to have more of a focus on addressing addictions and the recovery supports to do that. And I have a paper that I'll provide with you. We've done some initial outcome data studying on the process of recovery coaching. It's peers working with others in recovery. And I'll share the paper with you. Thank you.
Thank you.
Good work.
Hi, I'm Jerry Kilcourse from Montpelier, and first of all, I'd like to thank the board for their work so far, and to keep going with it and stay strong, because you have some very powerful enemies that are trying to derail you and do everything they can to do it. Any kind of real reform, which is at least 60 years overdue, such as single payer, should include eye care, vision, teeth, your dental care, long-term health care, or else it really isn't comprehensive. Mental health too. Aren't my eyes part of my body? Aren't my teeth part of my body? My brain? Or anything else? It's why it's so convoluted at this point is because of the system we have, or non-system. Secondly, the insurance business really has killed doctor-patient confidentiality. A friend of ours mentioned that he had he was having a little trouble remembering things. That went into his file. He applied for long-term care, and apparently the company looked in his file and found out about the note the doctor wrote, and they denied him coverage. So, I mean, this is something that should be addressed, and something that shouldn't happen. In any case, once again, I'd like to thank you for your work, and just keep going with it.
Thank you. Okay, it looks like we will go now to Rutland.
Hi, my name is Sarah Nellore. I live in Rutland Town, Vermont. I am a member of the Healthcare as a Human Right campaign. For several hours each week or month, I do work at the Turning Point Center of Rutland, at NAMI Connection of Rutland, and at the Housing Trust of Rutland County. In this work, I've learned a lot about people living with low incomes. Many Rutland residents receive inadequate health care. As a disabled person, I receive Medicare benefits and Vermont's Medicaid benefits that together cover almost all of my medical bills. Everybody should have such good health care coverage. Even in this excellent system, I have experienced some gaps that threaten my health and wellness. Only 3 root canals are covered in a lifetime, and I have needed a 5th root canal since 2008. The tooth is infected, and I am in danger of losing it. Permanent crowns, which are usually needed after a root canal, are not covered at all by Vermont Medicaid. Eyeglasses are not covered, and I need specialty lenses every 3 to 5 years that cannot be made at discount prices. Vision and dental coverage ensures an individual's ability to function effectively in the community, but when they are not covered, they are sometimes impossible to afford. Please create a healthcare system that includes everyone and includes all of their healthcare needs, paid for by a progressive income tax. Thank you.
Thank you.
Hello, my name is Pat Jubek, and I want to thank you for doing this, and I know this is a really massive job. I want to thank the Free Dental Day because I went and had an x-ray. I had a tooth extracted, but in the process, when they did an x-ray, they saw a cyst. I have a 1.5 centimeter cyst on an impacted wisdom tooth, like I need wisdom. And the Medicaid doesn't want to pay for it because I don't have dental coverage. And I told them they have to pay for the biopsy, and of course they're not going to pay the lab fees, and they're saying, well, maybe we do. We don't have any guidelines. I said when they take out the biopsy, the cyst, to do the biopsy, they have to take out the wisdom tooth because it's right there. And there's a risk of nerve damage. I mean, I'm ready to sue somebody because my mouth is my body, and we're talking about a cyst here. If this was just a tooth, I would deal with the cost. I got a $2,182 estimate today, and I work 16 hours a week. I'm 60 years old, and I can't get much madder than I am right now. I just can't believe, and you know what? I've learned over the years, I didn't have insurance until 2000 with the company I worked for. And, you know, I always went with God, and God's been good to me. And I guess it is because I'm lucky that they had Free Dental Day, and I saw that I have a cyst I didn't even know, and my jaw is going to break. Now, if that jaw breaks before I get it out, then I'll be in the hospital with a wired jaw. That's going to cost thousands of dollars. I believe totally in preventive health care, but it's a whole body. It's your spirit, everything about you, your mind. It's all of a person. I don't even know how this country has not been treating the whole person. And I'm just totally furious, and I thank you for even listening to me. I know financially this is going to be a massive job, you know, and I know it can be done. It's not going to be easy. I mean, you need some good finance managers. I've taken a coding course, and I found out what my doctor sends for a bone density test, and they tell him, you can't do it. It's coding. You got to code it right. You got to ask right. Thank you.
Thank you. Next, we'll go to White River.
She's smiling.
My name is Sharon Recuson. I'm a member of the Vermont Workers Center and also a member of the Healthcare as a Human Right campaign. I thank the board for the progress that you've made thus far in our path to universal health care for all. I do hope you resist all the pressure from the insurance companies. We know they're already putting pressure on you. All I really want to say is for all the people in Vermont and my family and my neighbors, I hope you stay focused on the common good, the fundamental needs of all people, and not the profits of the insurance companies. I'd like to see them disappear, the insurance companies, that is. And I hope that you include health care, dental care, and mental health care, as the woman said from Rutland, the whole body. And I think you know how to do this. The path has been set. The Dr. Chow wrote a very good document, and there are plenty of examples in this world, in Asia, in Europe, and in Canada. It can be done, and we know we can do it, and I have faith that you will get it done. Thank you.
Thank you. We'll go now to Williston.
Hi, my name is Shannon Lyons, and I'm a nurse practitioner with Planned Parenthood of Northern New England. Planned Parenthood currently has 10 health centers in Vermont, and last year we served 17,000 patients and had over 25,000 visits. Making healthcare, including family planning, more accessible and affordable is one of the most important issues facing our state. Planned Parenthood health centers are an integral part of Vermont's healthcare safety net and will continue to play a vital role in serving the thousands of Vermonters who will become newly insured under the Affordable Care Act in the coming years. Through our health centers, women have access to the essential primary and preventative health care services that promote and protect their health and well-being. In fact, many Planned Parenthood patients rely on our health centers as their main source of health care. We provide cervical cancer screenings, breast exams, STI testing and treatment, abortion care, testing and treatment for urinary and vaginal infections, adult immunizations, cholesterol screenings, and much more. The Affordable Care Act will have an enormous impact on expanding women's access to essential health care services. Unfortunately, just as the cost to provide health care and demand for services has increased, funding for family planning has remained woefully inadequate. As we all know, family planning programs have been subject to political attacks designed to undermine women's access to these important services. As Vermont moves forward with the health care reform, we must work to ensure continued access to Planned Parenthood health centers as essential health care providers and support Planned Parenthood's ability to participate in state-based health insurance exchanges. We must support, improve, and increase women and men's access to family planning care. We must require insurers to cover all FDA-approved prescription contraceptives in the same way they cover other prescription drugs. And lastly, we must support abortion care in this exchange. Access to reproductive health services is critical for women in our state and must remain a priority. Thank you.
Hello, my name is Olivia Clemens, and I'm interning at Planned Parenthood of Northern New England. I'm here to read a testimonial on behalf of one of our Burlington patients who rely on Planned Parenthood for health care. Devin says, 3 years ago, I started my own business, which meant that I had to pay out of pocket for health insurance. The business started out slowly, and the only monthly premiums I could afford were for a catastrophic plan with a $5,000 deductible, which did not cover my annual exam, birth control, or doctor's visits. Planned Parenthood helped me find a less expensive prescription, and they allowed me to pay on a sliding scale based on my income for the care I received. Aside from lifting a huge financial burden, they provided a more caring, professional, and knowledgeable medical experience than any other OBGYN or general practitioner I've ever seen. I've since been able to afford a better health insurance plan, but I still choose Planned Parenthood for the level of care they always provide. Last year in Vermont, Planned Parenthood of Northern New England provided 23,378 STI tests, 3,285 cervical cancer screenings, and 4,558 breast exams. Access to reproductive health services is critical for women in our state and must be a priority. Thank you for your time.
Thank you. We'll go now to Brattleboro.
Hey, everybody. Hi. Hi, my name is Sheila Linton, and I am a proud member of the Vermont Workers Center Healthcare is a Human Right movement and campaign, and I'm here today to share my story of my challenges and my struggles and my success. I am born and raised in Vermont, and I'm a single mom with 2 beautiful daughters. I chose to go to college and have received 2 degrees and had been on my career path for the last 8 years until recently when I was laid off from my job with no warning. I have now been forced into survival mode and must immediately find a job as I have been denied unemployment. Undoubtedly, most of us can say the stress of being unemployed, having no financial means, and raising children is challenging. I am thankful that in our state of Vermont, I and my children are faced with one less obstacle: health care. Living and working in Vermont comes with many challenges, as most of the jobs are from small business owners, service workers, nonprofits, and other entities which do not offer health insurance. Primarily, my work career has been in the nonprofit field and unfortunately has not afforded me benefits of any kind, including health care insurance. As I currently look for work in our scarce job market, I yet again find more jobs than not that do not offer health insurance of any kind. A challenge, but in Vermont, we are succeeding. Being in Vermont, I am able to access Dr. Dinosaur or Medicaid for my children and VHAP for myself. Now, while trying to find work, I can rest assured that if I cannot find a job with insurance, then me and my children will be able to access these programs. And there will be one less stress as we prepare for the physical exams for summer camps, routine dentist appointments, much needed shots for school, and the random cold. Not to mention my own needs dealing with my ability to be physically healthy and needing 2 major operations to aid me in this process. I need to be healthy so I can work, so I can take care of my family. However, as challenging as this situation may be for my family, I know we don't face it alone.
Time.
Our family could be considered one of the lucky ones. Not every family qualifies for these services. Without these vital services, I would have
Time.
to find a job which offers health care or would be forced to add numerous health care debt to my ever-ending student loans. I ask
Thank you.
that
We
you
need to
put a
move on to
system
the
in
next
place
person
that
now.
delivers universal health care. Thank you.
Thank you. We are now going to Montpelier.
Whoa. Hi, my name is Sandy Gaffney, and I'm going to welcome the time because I don't have anything to read. What's important to me is to be able to be here and listen to all these stories that are so important. They're very touching, but what I'm really, really excited about is the fact that we are going to have a healthcare system that does put people first, and my wish is that for all of us, not just this board, but for all of us in this state, not get almost terrorized by the insurance companies and the scare tactics that they use sometimes to scare people into thinking that they're not going to get the care that they need when they need it. And also about the money. The money is there, as everyone has said, but it's in the pockets of the insurance companies, and that is why they are trying so hard to keep us from having the universal health care system that we all deserve and we all need and we all want. So they're not going to get that money. We are. Our state, we're going to keep that money in our state to take care of our health care system. And I'm just excited, but also I know there is a fight ahead about this, and I'm behind you, and I'm with you, and I'm with every other resident in this state of Vermont. And we will not be cowed by the big money of the insurance companies trying to save their jobs and their bottom line. But I really believe that our health care is the most important thing. Thank you.
Hi. I get a little nervous, so I'm going to read, but I appreciate your time in listening to everybody tonight. My name is Amy Lester, and I'm also a member of the Vermont Workers Center and the Healthcare as a Human Rights campaign. I'm here tonight to share my experiences as a guidance counselor in a local high school in Barrie. And how these experiences have framed my decision that health care should be accessible, comprehensive, and focused on care and not coverage, all according to Act 48. I recently was working with a student whose grade was, she was close to failing. He was, and the majority of his classes. When I approached him, he relayed that he was missing lots of school, mostly because he was transporting his dad back and forth to Dartmouth, who was undergoing chemo treatments. But also, his mouth was in a lot of pain. And I asked him how long it had been since he had been to a dentist, and he said, oh, probably about 10 years. We don't really go to the doctors or go to the dentist in my family. And so, you know, I helped him make some calls from my office, and there was one place that took, he was on Dr. Dinosaur, and there was one health center in our area that takes those patients, and they have a waiting list. So he was not coming to school for a while until he could get in, and that breaks my heart that there is somebody in one of the richest nations of the country who isn't coming to school because he couldn't get his tooth pulled. There's another young woman that I'm working with, and I spent the better part of this past week helping her negotiate insurance because she is not in her home. She can't be in her home anymore. And I mean, as you know, I could go on and on. There's lots of stories, and I think we can do better. I know we can do better, and thank you for your time.
Thank you. We'll go now to Rutland.
Hello. Should I start? Hi. Hello. My name is Linda. Most of my life, my mental health has been challenged by both internal and external circumstances. The obstacles I face are often unpredictable. Fortunately, I have been able to build up a support system which has allowed me to increase my functioning. A few years ago, I became unemployed, and so I enrolled in the social work program at Castleton State College to help others like myself. I was receiving Medicaid for the working disabled at the time, but I found it too challenging to balance working with going to school 5 days a week and doing my homework, so I quit working. Since then, I have lost my Medicaid because the system calculates my student aid and student loans into the equation and deems me to be over income. Without my supports, I have a greater chance of failure. So my plea is that you continue to provide parity, not only for myself, but for all persons like myself. I have seen far too many people, especially with the closing of the Waterbury Hospital, fall through the cracks and struggle with everyday life due to lack of support for their mental health needs. We need a system which helps individuals, and this does not necessarily mean institutionalization. Thank you for your consideration.
Thank you. We'll go now to St. Albans. Could we hear from the first person in St. Albans? Perhaps we don't have anyone in St. Albans. Did we lose St. Albans? Oh, there you go.
I am a Vermont Worker Center, and the health care is a human right campaign. I am here to tell my story about my challenges with dental care. When I was young, my teeth started going bad. They started turning yellow because of the meds I was taking, phenobarbital and dilatant. Also, when I was a kid, I ate candy and drink soda. It wasn't good for my teeth. I was doing what everyone else was doing, and we shouldn't be blamed people for these things. In my teeth and the 20s and 30s, I had Blue Cross Blue Shield dental coverage because of my parents working. But at one point, I could not be on my parents' insurance anymore, and I had to rely on Medicare. I don't think these problems are as good now. I have many problems with my teeth, and I am having to have all my teeth pulled out one at a time. I am here to say how important dental care is. While it is important that we all have dental care. We don't want to have dental care if it means that other members of our community needs are not met.
Thank you very much for testifying. Do we have a second person in St. Albans?
Yes, we do. Hello, my name is David Pepersky. I am a member with the Vermont Workers Center. Today at work, I was cutting and grinding concrete. I wore a respirator to protect my lungs from silica dust, also hearing and eye protection. I wear safety equipment on the job because I care about my health. Off the job, I live a healthy lifestyle. It is a choice I make. Also, part of the reason that I am healthy is just a matter of simple good luck. What bothers me about the current healthcare bill, H559, is that we are asked to choose between 3 different plans based upon affordability. Yeah, I guess having a choice makes dollars and cents, so to speak. I also choose to take care of my health, and so far I have been lucky. The problem is, not only for me, but everyone else, despite our best intentions and choices, we all face the possibility of becoming very sick or even the bad luck of getting into an accident. Please, Green Mountain Care, do not let our Universal Health Care Law Act 48 become watered down by our opponents. Health care for all Vermonters must be affordable and comprehensive. Health care is a human right and well within the people's budget. Thank you for listening.
Thank you. We'll hear now from Williston.
Hi, my name is Dr. Sam Russo. I'm a naturopathic physician and licensed acupuncturist in private practice in South Burlington, and I'm also a naturopathic advisor to the Office of Professional Regulation, and I'm here representing myself and other physicians in my practice. I would like to urge the board to continue to integrate naturopathic physicians as primary care providers, specialty providers in universal health care coverage. And specifically, I also want to talk about some cost-saving services that I think could be integrated. Number one is to include coverage for acupuncture, which has been shown to be cost-effective for the treatment of many conditions. According to the NIH consensus statement on acupuncture, it is a therapeutic intervention that's widely practiced in the United States, and there have been many studies of its potential usefulness. Many promising results have emerged in acupuncture research showing efficacy of acupuncture in many conditions such as asthma, addiction, stroke rehabilitation, post-operative and chemotherapy complications, sports injuries, and in particular pain conditions, which is important considering the problems with prescription pain medications that we do experience. Acupuncture can also be useful as an adjunct or alternative treatment or be included in a comprehensive management program where cost savings can be seen through the prevention of need for medications or surgery in some conditions. The second cost savings recommendation is to increase utilization of diagnostic ultrasound in musculoskeletal conditions in place of more costly imaging techniques when appropriate. Musculoskeletal ultrasound is an excellent imaging modality, particularly for the extremities, and even has a higher resolution than MRI or magnetic resonance imaging. Ultrasound allows for the evaluation of joints and soft tissues in real time without radiation on equipment that's portable and can be used by a variety of practitioner specialties, not just radiologists. That's about it then. Thank you very much.
Thank you.
I'm a rheumatology nurse, and I struggle almost every day trying to figure out how to make expensive medications affordable for our patients. These patients have poor insurance coverage or policy exclusions, and it's gotten so bad that we really need a social worker to be managing this. However, you know, instead it's taking up the nurse's time, looking into options such as independent grant foundations, drug company programs, state programs, and each individual is different for what they may be eligible for, and sometimes there is no assistance available. And just briefly, I agree with other people who have said that we must commit to a comprehensive, meeting the comprehensive health care needs of all Vermonters through a single-payer system, and this is really what health care reform is about. Thanks.
Thank you very much. We'll go now to Middlebury.
Yes, good evening. Can you hear me?
Yes.
My name is Judson Hescock. I am a resident of Cornwall, Vermont, and I'll be a second-year law student at the University of New Hampshire School of Law. And I just wanted to make a brief comment about how universal health care and state subsidized health care in the state of Vermont has been and should be expanded, and is a critical element for economic development for the middle class. As a youngster around age 8, I had a lot of medical issues. I had a spleen removed, lots of numerous procedures done at Fletcher Allen, and my family, we were not eligible for Medicaid, but qualified for the Dr. Dinosaur program, and that allowed essentially my family not to go bankrupt, and my siblings also had some medical issues, and so we recovered from that, and now my parents are able to have a small business, and we employ multiple people. I've been able to go on to higher education, but without the state subsidized program, we would have been pretty much destitute, just gone bankrupt. So I would just like to encourage decision makers and remind them that state-sponsored programs like Catamount Health that I think should be expanded are really important for the people kind of, above whatever poverty line we might be discussing, but below the high income bracket that can afford maybe a Blue Cross plan, that it's really critical for that group who can then often pursue economic development like my family's small business. For if there's available affordable health care, it's just really, really important, and important for the Vermont's economic future. Thank you.
Thank you. Montpelier.
Hi, my name is Joyce Wernken, and I'm a volunteer with the Vermont Workers Center Healthcare Campaign, and I work at the Vermont Center for Independent Living. And I work in a program that provides, that gets very limited funding for assistive technology. And a major amount of our applications are for folks needing dentures. And we can only provide dentures for folks that is directly related, such as the woman who spoke, to their disability, because it's a disability program. And if we could easily go through all of the money in a month for the amount of applications for folks that need dentures. And it's important to their physical health, to their well-being, to their self-esteem to have that coverage. So I hope that you'll consider that in your work, and I appreciate all you're doing. Thank you.
Thank you. We have someone in Newport.
Yes, hello, can you hear me?
Yes.
Okay, hi, I'm Andrew Traverso Estes. I'm a resident of Barton, Vermont, and I'm a member of the Healthcare as a Human Right campaign. With the ongoing research progress, cutting-edge technology, and state-of-the-art facilities available, it is deplorable that many of us do not receive the care we need when we need it. Healthcare is a human right and should not be a commodity privately bought or sold on a market controlled by insatiable for-profit companies. Instead, our healthcare system should be equitable. Healthcare should be treated as a public good that can be accessed by everyone, not just those who qualify or who can afford it. Our country's current approach to healthcare is not working to provide the services to those that need it, only working for those who can afford it, and those who are able to buy insurance suffer as well. Here in Vermont, many of my friends and family members go without the care they require, and some still struggle with overwhelming debt from medical bills. Because of private insurance companies' agenda, we are stuck with high deductibles and co-pays, and the cost is so much that we have to pick and choose which aspects of our health is in most dire need of attention. We should not have to decide individually or as a society what aspects of our health are most important, and we cannot replace the system with another system that asks us to. I ask that under Act 48, the Green Mountain Care Board create a universal, equitable health care system that encompasses all of our medical needs. Thank you.
Thank you. We will go now to Williston.
I speak to you tonight as a member of the Healthcare as a Human Right campaign. Like others before me, I'm sharing my story because the benefits discussion must first start with people's health needs and their ability to get the comprehensive, appropriate care required by Act 48. We need a health system focused on care, not coverage. My name is Kate, I'm 16, and this is my story. About a year ago, my brother came out as transgender. Transgender, a person whose gender identity differs from their gender assigned at birth. While physically female, my brother identifies as male. He has what is called gender identity disorder, a disorder plagued with intense emotional distress. Imagine fearing violence, rejection, and prejudice. Imagine feeling depressed, misunderstood, and incomplete. Now imagine all of this every second of every day. That is the life of a transgendered person. But like other disorders, gender identity disorder has a treatment. And for many transgendered people, this treatment is as medically necessary as radiation would be for a cancer patient. Therapy, hormones, and surgery are proven to be effective methods of treatment. Feeling normal is something that most of us take for granted. While a transgender person may never feel normal, treatment alleviates much of the suffering caused by their medical condition. Being transgender is not a choice nor a phase. It's a disorder and one that affects many Vermonters. My brother pays out of pocket for whatever his insurance does not cover. He is a full-time college student working multiple jobs. To deny coverage medically necessary in treating gender identity disorder is overt discrimination. Gender discrimination, like all other types of discrimination, has no place in healthcare. You've heard my story, but what I've had to say should not be at the cost of anyone else's needs. I believe in treating healthcare as a public good where everyone's needs are met. Green Mountain Care's job is invested in the health of Vermonters. Thank you for your time.
Hi, my name is Becca Mandel, and I am a small business owner living and working in Burlington. I'm a member of the Healthcare as a Human Right campaign. I was born and raised here in Vermont. My business partner and I started our business last year, and things are going really well for us. We actually just hired an additional employee to help us keep up with all the work that we've got, which is great. As an entrepreneur in the community, I'm proud to be able to create jobs, but I want to be able to provide good family-supporting jobs. Providing health insurance to our employees is a huge concern for us. In fact, we are considering cutting back and not creating any more new jobs and not taking on new work so that we don't have to deal with health insurance headaches when we hire folks. We are counting down the days until we have universal health care that meets human rights principles right here in Vermont. Currently, we are spending way too much every month to provide health insurance for our employees, and unfortunately we made the difficult decision that we cannot afford to provide dental insurance. As a new business, we are being conservative with our expenses to ensure the long-term fiscal health of our company. This means that I haven't been to the dentist in 2 years because I didn't have coverage before that either. I know how important oral health is, how it's connected to cardiovascular health, and how essential preventative dental care is, but it's a huge expense and one I cannot afford on my own. I'm terrified now to go to the dentist because of the work that I might need. I'm another victim of the short-sighted trap caused by the way that our current healthcare system divides our body up into sections worthy of care and sections that are not worthy of care. We must not fall into that trap with Green Mountain Care. My whole body and all of your whole bodies are worthy of care. We must include our whole bodies in our healthcare system: dental care, mental health, reproductive health, non-traditional medicine like acupuncture and acupressure. Every Vermonter brings a different set of needs to our healthcare system. We must ensure that our new system meets all of those needs. We cannot cover dental health at the expense of mental health or prenatal care or reproductive care or alternative medicine. We must have a healthcare system whose purpose is to meet our needs without pitting us against each other and imposing artificial and outdated cost constraints. Thank you.
Thank you. I believe we have a third person in Williston, so perhaps we can stay with Williston.
Hi, my name is Rachel Van Cleef, and I'm a member of the Healthcare as a Human Right campaign. Thanks for the opportunity to testify. I want to speak in support of care for alternative modes of medicine, such as naturopathic care. My personal story with naturopathic care, 4 years ago, I developed, 5 years ago actually, I developed a debilitating fatigue. I spent a couple of years not being able to work more than 20 hours, not being able to accept social invitations, not being able to do chores around the house, just sort of generally withdrawing from being able to live an active life, and not being able to find a diagnosis despite good coverage because I had not yet found the right naturopathic doctor. So I had been seeing my primary care doctor in my regular MD, and she had given me every test she could think of for Lyme disease, for heart function. I'd gone to therapy to see if it was depression. I'd done all sorts of things. I had a $2,500 colonoscopy in case it was related to digestive stuff I experienced. And finally, I found Dr. Bernie Noe in Montpelier, who testified earlier tonight, who diagnosed me with hypoglycemia. And there is a very simple solution to my debilitating problem, which was to eat a high-protein diet. So this one visit with a naturopath radically altered my life. I'm on the road to health. I have much more energy now. And it's also much more cost-effective than many of these medical tests that I had gone through. I believe that naturopathic doctors are trained to recognize certain kinds of diseases that medical doctors are not trained to recognize, and that it's complementary, that not every one of our symptoms or problems fits into the box of one discipline or another. And in my case, in addition to being life-changing, naturopathic care was also more cost-effective. Thank you.
Thank you. So we have one more person signed up to testify at 6:45, so we are a little bit ahead of schedule. So I wanted to show on the overhead the email address that people can send written testimony to. So that should show up on your screen. There we go. All right. There you go. Yeah, and I should start doing some sort of demonstration now. So if you have additional comments that you didn't have time to express, or if you'd like to send your written testimony, please send it to this email address, sov.hcr@state.vt.us. And I think what we'll do is take a quick break, see you later. We'll say see you later.
We have to go up the stairs like in The Sound of Music.
Hi, everyone. Thank you. And we're reconvening. Al?
I was going to sing our song, but we were leaving.
As you see, we've gotten a little punchy here in the 5-minute break, but we do have one more person to testify here in Montpelier, so please take it away.
In Montpelier, I've been here about 25 years. I'm sorry, I don't know whether I'm going to be redundant with what you've already heard. There are lots of things we need to cover. I just want to make you aware that the dental problem here has become terrible. Nobody's getting their teeth fixed anymore. They're all getting pulled. Pulled. My patients are coming in telling me their teeth are being pulled. They're not coming saying, I'm going to the dentist, I'm going to get them repaired. They're getting them pulled. There are plenty of other things to say, but I'll look over what you've already heard and talk to you in the future. Thanks.
Yeah, we've heard several examples of that tonight.
See you. See you.
So with that, I think we've accommodated everyone who asked to testify, and we very much appreciate everyone coming tonight and staying here with us to hear other folks testify. I'd like to say a special thank you to Marissa Melamed for organizing and doing all the logistics. And also to the Vermont Department of Health District office staff, each of whom have appeared at one of the VIT sites to help people sign in. So thank you to Department of Health. And of course, thank you to everyone who testified tonight. It was a pleasure to hear your stories, and we very much appreciate you coming out. Do you want to say anything else?
No, just thanks as well. Thanks also to Devin, our timekeeper, and thank you all for your time and attention. We appreciate your stories, your thoughts, and your advice.
Could I add one thing?
Yes, please.
This few minutes, it's Linda Brownells, who's been here for 23 years. Her last moments as the director of this VIT program.
Thank you, Linda.
Thank you.
Good night.